Hi, my name's David Farnes, and I'm the Mobile Health Lead with the Canadian Advanced Technology Alliance, CATA. And you're joining us today on CATAnetTV on our new specialty channel devoted solely to mobile health. And today I have two guests. With me today are Hisham Al-Shurafa and Dr. Rahul Mehta. They're both co-founders of Calgary-based SnapDx. And we're going to hear how this group of doctors and engineers is working to make medical knowledge more easily accessible to both physicians and patients. So Rahul and Hisham, welcome. Thank you for joining us today.
Thanks. Thanks for having us, David.
Yeah.
So Hisham, maybe you can lead off for us, please, and just tell the audience what your innovation is.
Yeah, sure. So, based on Rahul's experience as a physician, we realized that there's a lot of medical information out there, and medicine is becoming more evidence-based. It's becoming more kind of algorithmic or statistics-based. But for a physician or even for patients, if you look online at the solutions out there, there's a lot of information. A lot of it is very you have to read through a lot of text or to actually get the information you need. So at SnapDx, what we're doing is we're kind of taking all this medical information and turning it into more kind of visual, interactive applications where you can actually just put in a patient's medical history and get information relevant to just that patient's medical history, and where you don't have to read through a lot of text. You just kind of interact with these kind of cool infographics to, for example, compare different drugs and chances of different side effects between different drugs. So that's what we're doing with SnapDx. We're kind of taking medical information into this 21st century from text-only representation to more interactive visual representations.
And Rahul, maybe you can explain to us, what does that mean for you as a physician?
So the problem, as Hisham described, is the fact that medical research has been exploding over the last few years. There's actually been more research being produced over the last 10 years than in 100 years before that, just to give you an idea. And the problem becomes, how do you contextualize that research within the patient care setting? Basically, we're building clinical and decision support tools that help physicians make the right decisions at their point of care. And the way we do that is through essentially some data visualization software that Hisham's built, which not only tells the physician what the best possible evidence is in a given clinical setting, but also helps engage their patients as well. Because, as everyone knows, if you try and present information to somebody, it's best if it's given through a verbal approach, through a visual approach, and through maybe even a text-based approach. Instead of just telling the patient what to do, they get to see, why they should do it, and they get to interact with some of the data behind the decisions that the physician's making around their clinical question. So that's a general. I know it's pretty high-level stuff, but what we're trying to do is really build point-of-care tools that both physicians and patients can use right at the point of care.
So basically, right bedside, essentially, when you mean
right bedside, exactly.
Yeah. So now, where are you? Where are you? What are the plans for 2014 in terms of introducing this?
So we essentially, completed kind of first version of our prototypes. We won some business pitch competitions, got some interest from both, academia, physicians, and corporations. We're in the middle of starting a couple of pilots here in Calgary, in the hospital here, and we're going to release our first product. The early adopters in medicine are medical students and residents, so our first product is going to be geared towards that, and that's going to be released in February. And we're very close to getting kind of a first kind of paid customer, which we'll announce at the right moment.
Absolutely. So Hisham, what has helped you bring this product along, and what obstacles have you encountered along the way?
Yeah, well, when building any kind of medical software company, it's important to have doctors on board as part of the core team. And so you definitely need kind of the business or the software experience, but your main customers are going to be doctors. So it's awesome that we have Dr. Rahul Mehta here, who's part of the core team. I think that's really important for any kind of health company if you really want to succeed and offer a great kind of experience for your customers. And that solves a big one of the big obstacles in building a solution or getting the attention of people in healthcare or hospitals is sometimes it's hard to get those meetings or get the attention, or sometimes decision making gets slower. But if you have doctors on the team, if you're seen as an insider rather than an outsider coming in, that helps a lot and just makes things move fast. And we do have that advantage. In fact, there's more doctors in our team than engineers. So that's pretty much the main kind of obstacle in healthcare is doctors are great, but they don't build products, and engineers are great, but they're not inside the system. So we have the best of both worlds here.
Well, it sounds like a great team effort, and we're certainly looking to see the introduction in February, and we'd love to follow up with you and do anything we can to help advance your goals.
Sure.
So thanks very much for joining us today. This is David Farnes with CATAnetTV. Joining me today were Hisham Al-Shurafa and Dr. Rahul Mehta. Both are co-founders of SnapDx, located out in Calgary. You can find more information about them at snapdx.co, and we'll have that information available on the CATAnetTV website. So until next time, thank you very much for joining us. Thanks, guys.
Thanks, David.
Thanks, David. Yeah. Have a good day.
Yeah.